pneumonia.
A came
So
before
in the
B
pre-vax
does
era,
not mean
about
A
500 people,
caused
mostly
B.
children, obviously they're the ones that are susceptible to this, used to die in the United States each year with measles. And now, because most people are vaccinated and protected, they don't. So there's some easy math for you. I know just giving numbers doesn't always convince, but I have all my sources at the end, and sources is another thing I'm going to discuss. But wait, there's more. If you're somebody who just doesn't believe that this will happen today again, this whole resurgence, if we stop vaccinating and protecting our kids, just remember what happened during the measles epidemic in the early 1990s. Now, I did not remember this. I was very much alive, but was not paying attention to anything outside my little bubble, obviously. So there was a drop in measles vaccination rates, and there were 55,622 cases of measles and 123 deaths in the United States between 89 and 91. And in that same time, because this is things that a lot of people will say, oh, the reasons why the death rates used to be high with measles is because they didn't have, proper hygiene, sanitation, healthcare. No, that they had all that during this period of time. When I went to look up the reasons behind this particular outbreak, it was largely in New York City, and it had occurred after Reagan cut some funds that were going out to states to help with the public health outreach, vaccinations. And so although it was centered in New York City, there was pockets in most major cities where the poorest people lived, and they relied on public health clinics for their kids' vaccinations. People that relied on health clinics to get their and public funding to afford to get their kids vaccinated, with the economic downturn and then vaccinations not being covered, they just stopped getting them vaccinated. There was an estimate in New York City at one point that as much as 50% of the children, the school-age children, had not received both of the measles vaccinations. So when that's how it starts, small communities that have historically not been vaccinated, for instance, the Texas outbreak right now, I think they are looking at a community of Mennonites, maybe, that historically they're not getting vaccinated. They are always at risk, but part of what we do to protect them is the rest of us are vaccinated. So they are largely protected, just like in COVID, protecting the elderly. The rest of us get vaccinated and wear masks, so we don't put at risk the least among us and the most vulnerable. Remember how we used to feel that way back in biblical days? So what was happening is that there are still these pockets of people in big cities, and now they were exposing children that were unvaccinated. And then it was just spreading like wildfire through children. The hospitals, same idea as COVID, overcrowded. So what happened is that the local government decided to make this huge push for vaccinations. They included messages in Times Square, public buses. Apparently, even Michelangelo from Teenage Mutant Ninja Turtles was getting in on the action, like jumping out of sewers or something to get vaccinations. They were providing free shots at the park, beaches, concerts. This should sound familiar. The whole point being that vaccinations are it is so well founded what the benefits of vaccines are. And we can go back decades and decades and decades. People know what to do. Actual public health professionals and medical professionals and scientists, they know what to do with something like this. This was not this spike here. This wasn't a mystery. As soon as they saw the numbers climbing, they got together and figured out, okay, how do we get vaccinations up? And they made them free, and they went to places where people were, beaches and parks, and could easily access them. And then guess what happened? It dove back down as vaccination rates went up. And I'm sure there's still those of you who just decided that not only can the CDC data not be trusted, even though the CDC has been around through many, many presidents and has demonstrated the same trend of results with vaccinations, and how as vaccinations go up, hospitalizations, actual diseases, the disease, hospitalizations as a result from the disease, and deaths as a result from the disease all start to plummet as vaccines go up, at least under the last 5 presidents. But if you want to claim that the CDC is politicized and they're just putting out data because it's, I don't know. I don't know how they would benefit from that. Doctors that have dedicated their lives to helping eradicate diseases and keep us all safe. But if that's what you think they're doing, as well as reputable medical institutions like Johns Hopkins, Duke, NIH, if they've all the information has been fabricated by big pharma, then there's still more for you. Before the introduction of measles-containing vaccines in 1963 and mass vaccination efforts, measles was a leading cause of child mortality, with over 2 million deaths annually worldwide. So the data can obviously be much more dramatic when you look at the world as a whole. And because the world as a whole has more pockets of the underfunded areas, the obviously lower income, where they are largely relying on us and other rich countries in the world to provide them with vaccinations. So the World Health Organization expanded the program on immunization, launched in 1974, targeted measles among other diseases, leading to a dramatic decline in cases and deaths. In 2022, there was only 127 cases of measles and no deaths were reported by 15 out of 30 of the member states of the World Health Organization, representing a 99% decrease compared to just 2018. That's successful public health. That saves us all money. It's not just like that if you don't care about children, dying in India or whatever, but if you only care about yourself and your own country, this affects us. It's people traveling into our country when we are highly unvaccinated or continuing to grow into a more unvaccinated society. That's where we get it. That's where our people get sick. That's when our health system gets stressed, like in COVID. Steady decline in measles cases from 2000 to 2021 worldwide as efforts increased to provide children with 2 doses of the vaccination. This is just so, all the charts look like this. This graph represents measles deaths in Europe pre and post intro to the vaccination. And again, you can virtually find a graph that looks very similar from Australia, Canada, and Asia. These graphs will also look very similar to the ones in all of the other countries of the world that could afford vaccinations and pushed strongly to get them out and to promote how effective they were. This is what the graphs look like for smallpox, for polio, and yes, even COVID-19 vaccines. Highly effective at definitely still decreasing the amount of cases, but the primary goal of it is to keep people out of the hospital and dying. So if you are among those that honestly think that not only our country's medical institutions, CDC, all major universities, and medical scientists and professionals are in a big conspiracy to skew the data somehow, again, for some reason, to make money off of vaccines, maybe, which just aren't, I'm not even getting into that. But then you would also have to believe that all the countries of the world and their scientists and medical professionals are in on the same conspiracy because they all show the same data. I mean, listen to yourselves. That sounds crazy. That's crazy. If that's really what you think, you're also probably not watching this. And you definitely have more serious issues to contend with than being an anti-vaxxer. I am just so flummoxed at that whole line of thought. Where does that go? Where does that train lead? That's crazy. Thanks to vaccinations, this is a statement from UNICEF executive director. Thanks to vaccinations, more children now survive and thrive past their 5th birthday than at any other point in history. This massive achievement is a credit to the collective efforts of government partners, scientists, healthcare workers, civil society volunteers, and parents themselves, all pulling in the same direction of keeping our children safe from deadly diseases. We must build on this momentum and ensure that every child, everywhere, has access to life-saving immunizations. So I'm including my sources here, and I want to offer something on sources as far as these conspiracy theories go and how they get started and how they get perpetuated. As a parent myself, I'm going to regroup for a second. This is why I did slides, because I knew I would get on a tangent. So just let's try to be a more responsible source checker before just like screenshotting that first post I showed you with those different wonky vaccine schedules from different years. Like, if something looks like you're so excited to share it with everybody because it proves your point, just take a hot minute to just, I don't know, use the Google machine. Like, do not share things if your only source is a social media post or a Joe Rogan podcast. I don't care how much you love him. I don't care. He is not a scientist. He is not at all involved in medicine. Just look for actual sources. If you cannot find a reputable source that is not your favorite cable news anchor, don't share it. Like, the amount of time this took me to put together, and I am somebody who like lives and breathes science. Like, I'm always needing, like I said, looking up stuff for different presentations I do, looking up stuff for my patients and their caregivers. I'm always having to prove myself. Nobody believes anything I say, but that's good. We're used to having to show our work. Everybody should have to show their work now. Just stop taking the easy way out. Don't take a environmental lawyer's point of view and opinion on vaccines because he's been talking about it for 10 years. Actually look at what he said and what other health professionals say about what he says. It's so easy. A person can be considered an actual expert if you're looking to pass along something. Look for things that are validated by experts. An actual expert, if they have studied in this respective field, have spoken and written on the respective topic for longer than the majority of their peers, meaning they are probably highly respected by the majority of their peers. They're not having their peers or scientists and actual medical experts coming out and saying that, and discrediting them, saying that they are an embarrassment. Maybe don't share things from that person, that their medical school that they graduated from is telling us that no, we have distanced ourselves from this person that is saying that COVID vaccines are dangerous. And yes, okay, this is the last thing that I was going to say. In all fairness, as parents, I get it. We all are trying to make decisions about what is safe for our kids. I don't believe any parents out there trying to harm their children. But when you really think about it, this is what I sort of came down to. All of our decisions that we have to make for their safety are risk versus benefit analysis. It really all is that. When we decide to allow them, are they going to go to daycare versus staying home? There's finances, but they're going to be exposed to all these different things. Are they going to ride the bus versus me taking them to school? They're going to be exposed to bullying, horrible language, other, behavioral problems of other kids we can't control. It's all risk versus benefit, guys. We all know this as parents. So when you decide to not vaccinate your child, you have got to look at all of the data, not just your favorite social media influencers and personalities, celebrity personalities. Look at people that do this for a living. Look at people that have done this successfully and actually have been renowned for saving small populations in underprivileged countries, like Dr. Fauci, that was not getting paid all this money to go into areas that were highly infected with HIV, for instance. I'm getting on another tangent. Look at the history of the people that you choose to trust. There are going to always be claims out there. Anecdotal evidence is what it's called, largely, about what has happened to people after they received a vaccine. Nicki Minaj's, I don't know, cousin's brother, I don't remember, the swollen testicles after a COVID vaccination. You're going to have that stuff all the time. But here's one thing key to remember. The more a sample size grows, so when I say sample size, like in a study, the more people get vaccinated, the more you're going to have the same amount of, say, children who, there's a certain percentage of children who are going to end up hospitalized with an odd blood disorder. I don't know right off an odd blood disorder. If you hear a story or somebody that this person got a vaccination and ended up in the hospital with this blah, 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 first of all, you need to look at the time frame after the vaccination. It's well documented that most of these vaccinations, if specifically the COVID one, mRNAs, if it's 2 weeks following a vaccination, that is very unlikely to be due to a vaccination. You can look that up. I'm not including that in this one, but so look at the time frame afterwards, and then you just have to understand, statistically speaking, those same there's same medical complications, heart attacks, strokes that were naturally going to occur in our population, and deaths that were naturally going to occur in our population are still going to occur to people who got vaccinated, because hopefully, like when our population was close to being 95% vaccinated for measles, we had no measles, we had no hospitalizations, we had no deaths from it. But 95% of the people got vaccinated. So out of those people, you're going to have deaths from other things. You're going to have medical complications. But you have to remove yourself a little bit from needing to look at everything is, oh, were they vaccinated? Oh, well, there you go. Like, scientifically speaking, the larger a sample population is, you're going to have those same medical events that occur. So what you have to look at is, after vaccination occurred, did this incident of strokes, heart attacks, blood clots, all these things, did they actually go up? Or were they the same in this vaccinated population as they were in the general population? So please, 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 careful about drawing that causation.
Just because A came before B does not mean that A caused B. This is the oldest error in the misinterpretation of scientific studies. It's commonly used by conspiracy theorists to knowingly manipulate the data. But unfortunately, it's also repeated and spread by those that aren't intending malice, but they just haven't taken the time to evaluate the original sources, the original studies, which is why I'm saying what just this presentation took me hours and hours and days. So, yeah, it's time consuming, but if you don't want to take the time, then don't regurgitate information from an untrusted, unverified source. These conspiracy theorists on vaccines specifically cannot have it both ways. They can't claim that there is not enough research on vaccine safety and efficacy, and then in the same breath misrepresent decades of research from all these well-respected institutions around the world. And when I say well-respected, I don't just mean what well-respected by our generation. I mean, these are institutions that have been around for 40, 50, 60 years, that have done work that has proven over the years to be reliable, saving lives, helping improve our public health and safety. So just deciding, are you believing these institutions from around the world, not just our own country, or conspiracy theorist that claims can be very easily disproven by looking at some original sources that they're misquoting and misrepresenting. So, if you're apprehensive about getting a vaccination, understandable, makes sense. I was apprehensive about getting my own first baby vaccinated. I had all sorts of questions. I had a very trusted primary care physician that I went to, and she did not pressure me. She gave me information and studies on the levels of autism diagnoses in the vaccinated population versus unvaccinated population. And then she gave me data and studies on the amount of kids that got sick from smallpox, polio, measles, all of the things, and then how many of them came after the vaccinations. It really was a no-brainer. So talk to your doctor, not your hairdresser, not Nicki Minaj's cousin, not your neighbor who has opinions. Talk to your trusted doctor, get a second opinion from another trusted medical source, but only medical sources, physicians that do this and know the information. Please, please. Thank you. And I'm going to try to put out something, God knows not this long, for all of our benefit, but every week I'll try to become more concise and look at a new online vaccine myth that I can help debunk with some more cold, hard facts. Thank you for your time if you're still here. Have a good day.